Hi, my name is Shalini Isha Tomukia. My student number is 48054395, and today I'll be discussing how we can help Rosemary with her medication and symptoms. First, we are going to talk about using questions with motivational techniques. For the first question, as shown on the slide, I chose this question because it allows Rosemary to share her thoughts on her asthma management in her own words, and it opens up the conversation without any judgment and helps establish a baseline understanding of her feelings and practices. And for the second question, as shown below, this question allows Rosemary to reflect on the differences between well-controlled and poorly controlled asthma. This will hopefully encourage her to identify the benefits of consistent management, fostering motivation for better adherence. For the third question, as shown below, by acknowledging potential difficulties, this question creates an empathetic space for Rosemary to discuss barriers without fear of blame. It helps identify specific challenges to address, such as forgetfulness or lack of routine. For the fourth question, as shown below, this question invites Rosemary to think about the practical solutions that align with her lifestyle, which would encourage her to take an active role in finding strategies that will work for her. Lastly, the fifth question, as shown below, this question gently connects Rosemary's behaviors to her asthma symptoms without being confrontational, as it should encourage her to reflect on potential lifestyle changes that could improve her health while respecting her autonomy and wishes. Now I'm going to discuss targeted health behaviors. Priority number 1 is medication adherence because it directly impacts asthma control and prevents exacerbations. Regular use of preventer inhalers reduces airway inflammation, improving symptoms and reducing the need of a reliever inhaler. Rosemary's dispensing history shows that she is not constantly using her inhaled corticosteroids, which is likely contributing to her poor asthma control. Priority number 2 is smoking cessations because smoking exacerbates airway inflammation, worsens asthma symptoms, and reduces the effectiveness of inhaled medications, including corticosteroids. While it is a vital health behavior to address, it is ranked second because smoking cessations requires significant lifestyle changes and support, which may not produce immediate improvements in asthma symptoms compared to medication adherence. The last priority is physical activity and weight management because though it can improve overall health, respiratory function, and asthma outcomes, it is a longer-term goal that requires sustained effort and motivation. Given Rosemary's time constraint and reluctancy to exercise, addressing this immediately might overwhelm her, thus it is prioritized third to focus on more urgent and achievable behaviors first. Third, I'm going to present advice I would give Rosemary to motivate change. With regards to priority number 1, I would say the statement below as it acknowledges her current efforts, emphasizes the benefits of reducing symptoms, and offers a simple, actionable solution that aligns with her busy lifestyle. For priority number 2, I would tell her the following statement because this approach avoids confrontation, acknowledges the difficulties of quitting, and provides an alternative that fits her existing routine without overwhelming her. Lastly, with priority number 3, I would state the following statement as this advice avoids overwhelming Rosemary with major changes and focuses on achievable steps, making it easier for her to incorporate physical activity into her routine. Now I'm going to talk about medication adherence interventions, specifically strengths and weaknesses. When it comes to strength, number 1 would be improved symptom control. Consistent adherence to prescribed medications, especially preventer inhalers, can lead to fewer asthma symptoms, reduce exacerbations, and improve overall quality of life. This would help Rosemary experience better control over her condition and fewer interruptions in her daily routine. Secondly, empathetic and individualized support. The intervention provides Rosemary with a personalized care and practical strategies tailored to her lifestyle. This could make her feel understood and supported, enhancing her willingness to engage with the intervention. Thirdly, increased understanding of asthma management. Through a pharmacist-led education, Rosemary could gain a clearer understanding of how a preventer inhaler works to reduce inflammation over time, which may motivate her to use it regularly despite the absence of immediate symptoms. And lastly, encouragement of healthy habits. An adherence intervention might include tools like reminders or follow-up consultations that help establish a routine, making medication use feel less burdensome over time. Lastly, when it comes to weaknesses, number 1 is time constraints. Rosemary's busy schedule as an accountant might make it difficult for her to constantly implement new habits such as remembering to use her inhaler daily or attending follow-up consultations. Number 2, perceived lack of immediate benefits. As Rosemary only experiences shortness of breath during episodes, she might struggle to see the value of taking a preventer medication daily when she feels fine, leading to resistance or low motivation. Thirdly, potential of overwhelm. Introducing a structured intervention might feel overwhelming or like an additional responsibility, particularly if it involves using technology or attending regular pharmacy consultations. And lastly, sustainability challenges. While short-term adherence might improve an intervention, maintaining long-term adherence might be difficult without ongoing motivation and reinforcements, especially if Rosemary doesn't perceive clear, consistent benefits. Thank you for listening.